So you've arrived here today with all the equipment that you bring prior to the birth and the birth itself. Should we go through everything? Yeah, awesome.
So at 36 weeks, we bring along a birth pool, and this is all included in the fees and everything like that. We bring along the birth pool and the birth pool liner. A thermometer for maintaining the temperature. Water temperature is really important so that babies are coming from that one temperature into the same temperature. So those babies don't know they've been born until mummies bring them airside.
So we've all seen those in all the pictures and things online, that these
so
beautiful, big, soft birth pools.
So lovely. This one's actually one of our new ones with an electric pump and a liner.
Yeah, beautiful.
And we also have the TENS machine. The TENS machine was my go-to as my comfort measure in my labour, so I felt really strongly about embedding that, and that is incorporated in our fees as well. And these are brought at 36 weeks as well, our emergency medications. So a lot of our people who inquire are concerned about the risk of bleeding, because that tends to be probably one of the most common emergency transfer reasons. And so at 36 weeks, when we bring along the birth pool, bring along the TENS machine, we also bring along emergency medications just to pop in the couple's fridge. The second midwife also knows where they're located in the fridge in case we need to get to them in a real hurry. So we bring along a whole host of them, and it's not to fear, because in most cases we actually take them back away. We put them in our esky bag with our ice block, and we take them back home again, unopened. So it's not that we're midwives, we're absolutely not. But when you're not close to the hospital, it's really important that we actually just make sure that our women are safe.
Of course, this is the safety aspect of home birth, is actually you've got everything that you could potentially need to manage an emergency at home.
Absolutely. So we bring along syntocinon, which is artificial oxytocin. We bring along 5 of those. We bring along some tranexamic acid. We bring along ergometrin, and we also bring along sintometrin. And each of those work very differently in a postpartum hemorrhage. That's why we actually cover all of that. But like we say, most of the time we actually break the ampules, we put them in our little sharps container, having never, and pour the fluid down the sink, because we've not actually needed to use it in normal physiology, which is beautiful. So that's what we bring for 36 weeks, so that it's all ready,
dropped off
so
to the
that
family.
those women can have their home birth from 37 weeks if they want to, if the babies decide it's time to come.
So this stays at home with the family. The dads can practice blowing up the birth pool if they want to.
And we do encourage that. We encourage them to actually have a play, and if they have children, allow the children to have a little jump in. Just not put the liner in and not put the water in. It's really good to sometimes have fairy lights in the pool. And the fairy lights can go between the pool and the liner, and it can give a beautiful little ambience and makes for really good photography and videography.
Beautiful. Okay, so then what comes with you on the day?
So we bring resuscitation equipment.
So the resuscitation equipment for the newborn.
Yes. We also have resuscitation equipment for moms in our bag as well, which is basically we have a bag and mask for an adult that would be extremely rare that we would need to use that. And then we have bag and mask ventilation for a newborn. And it also has a CPAP function on this bag and mask. So it means that's continuous positive airway pressure. So we can keep a little bit of pressure to help keep baby's lungs open. Really unlikely that we need to use this at home birth because the babies have not had drugs. So, and we've not had that same level of intervention, and we've had a normal birth. So it's really unlikely we would need to use it. We've used it a handful of times. We'd start in air and ventilate in air. And then if we needed to, we also have the oxygen that we can attach this tube to and give oxygen to the babies too. We also have a spare bag there as well if we need spares. We've got maternal oxygen mask, which if
Have you ever had to use that?
Once we used it. If the woman's feeling very unwell with blood loss, we can give her some oxygen.
It's very unusual.
It's very rare. It's very rare, but we've got that.
But you can manage all that at home if you need to.
We can manage that, yeah. And in that situation, we kept that woman at home.
Something that's different, sorry to interrupt you, about doing any of this sort of resuscitation at home is that you do it all with the baby's cord intact.
Oh yeah.
Which is evidence-based practice, making sure that they continue to get their oxygenated blood and on the mother.
Well, the evidence is they do much better and you're much more successful with your resuscitation if the cord remains intact, because they're still getting that blood and oxygen supply from the mother. If you cut that lifeline's gone. So we keep them together as well, and keeping them together as well is better for both of them. And we resuscitate with the baby on mom's lap because the cord is still attached and the placenta is still inside the uterus. So that's very different to hospital. We also have a newborn airway as well that we can place. Very rare that we would ever need to use that, but we bring it just in case. And we also have suction for newborn as well. Rarely do we ever have to use it, but most likely time to use it would be with meconium. If the baby comes out and it's not making any effort to breathe and there's meconium, then perhaps we would use it to gently suck out the baby's mouth and nose in that instance. And even rarer would we suck out a baby out because it was what we call mucousy. Most babies can clear that themselves, and you can actually do damage if you do it routinely. So again, evidence-based, we don't do that routinely, only if a baby was struggling to manage its own respirations.
And so for those that don't know what meconium is, that is when your baby has done a little poo on the inside, and so you're just helping to clear the lungs or the airways of any meconium that's been swallowed or aspirated by breathing in?
It can be an irritant if it gets down to the lungs, and it can affect their ability to ventilate and their lungs to work properly. So if we thought the reason a baby wasn't breathing and there was apparent meconium, especially if it was thick, then we'd probably do a light suction to help and assist with that.
And we often set all of the resuscitation stuff up at the start when we arrive, so don't think that because we've come and set it up it's because we're going to use it. We like it to be completely foolproof, so if we did need to use it, we're not having to
you're not
stuff
trying to go through everything. You set it all up so that it's ready if you need
it's ready, we test it, and we just have it all good to go.
That's the job of the second midwife actually. When she arrives, she checks all the emergency equipment to check that it's functioning and it's working and it's all present. She knows where the drugs are in the fridge, and she'll check the oxygen's working and that the tank's full and that everything's organised and ready.
Okay, so what's in here? What's in this one?
This is kind of the grab bag I have, that if things are happening really quickly or I need to get stuff quickly for the birth, I just have everything ready to go in here. So usually they're in the water, you don't need to use any of this, but if it was a birth on dry land, I sometimes have some gauze just to keep things clean. A pair of gloves if I need them, a pair of scissors. We have episiotomy scissors as well. I've never had to use them at home, but again, it's just about having everything ready to grab. It's not like we really use these to cut the cords either. So usually we don't actually use any of this. There is a cord clamp in here as well, but we actually use cord ties we routinely use. We just give the parents a cord clamp just to keep if they want it, and then we usually take it back a couple of days later. Very handy. Torch. I think I've got like 4 torches in here, but this is really just to grab if I think, okay, we need to rush in, we're going to have a baby really quickly. Blueies, essential. These are the things we probably use the most.
So for families, the blueies are like absorbent, big absorbent
like a puppy
pads.
And then I've got a heat pack as well in here. And another very important thing is a mirror.
So that you can see into the birth pools.
And we do have our curved mirrors, but I keep that in there because it doesn't like to fit in this one. And this has also got like initial immediate emergency equipment as well. So it's all nice and labelled. So it's all really easy to grab in an emergency. The best bit is that we all know each other's kits so well, but if in the rare situation where the second midwife wasn't a nesting hub midwife, then they can come and it's pretty clear how to use. So you've got fluids, we've got things to cannulate. We can take blood sugars, so if we're worried about a baby after it's born, we can do that if we need to. There's some drugs in here like ondansetron to help sickness. neural.
Yeah. So sickness, that's nausea of the mother during the labour.
There's vitamin K and things like that. Again, we rarely use this, it just kind of sits there. Yeah. And other little grab bits if we need anything in an emergency.
Yeah, so you can test mum's dehydrating, you've got urine samples.
Test their urine, we've got a speculum.
Yeah.
We've got something to break the woman's waters if that was indicated. Yeah. Again, it's not something we often do.
Yeah, but you can do it if you want to. Yeah.
But there's a lot in here, and my husband's made this incredible spreadsheet, so I can see when everything goes out of date, and I can keep it
and keep
updated.
stock of everything. Yeah.
And then you just have in here the baby's hospital blue book, and also we have the birth registration papers. So you don't need to go to the hospital to have all those. That's kind of our quick hit.
And having worked in the hospital setting before, how does this differ from what you'd have in your shelves in the hospital room?
Not at all, really.
It's exactly the same.
It's exactly the same.
Yeah.
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 I'd say we have everything that you have in the hospital in here.
But you have it in here.
Yeah.
But much less waste that we have than in a hospital, which is really great, isn't it?
So good.
Yeah.
And then this is kind of the bigger birth bag for extra storage that we bring in. So we've got vomit bags.
Vomit bags. I've got lots of those in my bag too.
Yeah, essential.
It's a good sign, isn't it? It's a good sign of progression of labour.
That's the cool curved mirror. We've got some very cute little baby grows. We bought it home, nesting home, which is always fun to give them. So good.
The women are like,
this is my favourite. If you need to sell it, if you need to suture, very handy. Yeah, you look absolutely ridiculous, but it's very, very useful.
Yeah, great. Well, you want to be able to see what you're doing there. Yeah.
And then in here is just more birth bits. So these are our massive, like, puppy pads to absorb everything. They're the best. I've got a nice little bowl for placenta.
Yeah, beautiful.
We can take nice photos.
So you do warm compress, you do all the same things that,
pads, wipes, a sieve.
What you don't see in the hospital though is the cord still attached and the placenta in the bowl with the placenta still attached to the baby. You never see, I've never seen that in hospital.
Yeah.
Yeah. So this is really just extra stock. We've got bedpans in case the women can't get up and use the bathroom afterwards.
So there's scoops for the birth pool. Yeah.
Different sizes. Just in case.
And Clinell wipes to clean it all, and we meticulously clean everything.
And so there's things there to catch physiological birth of placenta. Fabulous.
And then just underneath is really, again, more emergency equipment if we needed it. So, and the idea is that all of our birth bags are very similar.
Wow.
Yeah. So swabs, gloves, we've got suturing equipment here.
So that's for women that have a perineal, any sort of graze or tear. You put your head torch on, and you've got all the equipment to do any repair that they need to do, or they decide if they even want to have a repair.
They want to have a repair.
Often they don't,
they don't actually.
We wouldn't recommend suturing.
Yeah.
Depends what it's like.
But we have it. Yeah.
There's an option there. You know.
And then everything to do with catheter as well.
So you've got all the local anaesthetic that goes with that too.
Yeah.
I know that Gail mentioned before as well, you actually have the gas and air. You've got the nitrous oxide. You didn't bring that today because it's just too heavy and too big to bring. But at the nesting hub, you actually have that if women need it as a last resort.
Nitrous oxide and oxygen is a 50-50 split.
Yeah.
And, it can be helpful for some women.
Yeah.
Most people in home birth don't actually need it. But if we've used all of our kit, we've used all of our tools, our comfort measures, our positive encouragement, and we've just not got there, sometimes that can be helpful.
get over the line.
Yeah, I think reflective practice is really important, and after births we do have a little bit of a birth debrief as clinicians so that we can learn from each birth, and I think it's really important to have reflective practice. And you know, having nitrous just gives us another little string to our bow that might prevent a hospital transfer. You know, which I think is really important. These people want to usually have a home birth. We are really committed to making that happen for them. We will do everything in our power to make it happen.
What else have you got? That's your pump.
That's our pump. It's absolutely amazing, the Karcher pump, and I think it's about 20 minutes it actually takes to fully empty the pool. Isn't it amazing? Yeah.
Pumps the dirty water out.
In this bag, so you've got a sharp spin, blood pressure, cuff, thermometer.
We've got a birth stool here.
Steps monitor, the trusty Pinard, the Doppler.
And that's to monitor your baby's heart rate during the pregnancy for antenatal appointments and during the intermittent monitoring during the birth itself.
This is kind of what I just bring antenatally. A nice rebozo if we need to use it. You've got an awesome alternative kit as well, haven't you? But we usually just bring these with us. I've got acuneedling equipment, and then
all the oils,
potions and lotions.
That's been a new offering this year at the Nesting Hub, is Emma doing some acuneedling for our clients.
Amazing.
It's been absolutely amazing.
Really cool.
We've got birth herbs, blissful herbs, eye mask, magnesium tablets to support the uterus, you know, support tired muscles, electrolytes, bit of a massage, things going on, massage oil, birth combs, got 2 of these. And
these things are all really important. Like, people think it's all the woo-woo alternative stuff, but I see these placenta tinctures work, and I see all these different oils stop nausea or help bring on contractions or help provide
and the homeopathics, like the homeopathics are amazing. Like, some women will get a bit of fear at different times in their labour. Homeopathics can actually help in that regard, you know, because a lot of it is mental. You know, home birthing is predominantly mental. Mums and babies have been doing this for centuries, but if their headspace isn't quite right, we need to do something about that.
And just help them relax and you know, everything to flow, and then then everything works. Clary sage, aromatherapy oils, we've got a full set of those as well. And then, I even bring a little burner in case they don't have one.
We move in.
Magnesium spray, and then microwavable heat pack. Yes, I think that's everything. And same rebozos.
Beautiful. And so all the women in your care have access to everything that you've brought along here. So these are the things that you drop off: the pool, the emergency medications, and the TENS machine prior to the birth. So that's all there. And everything else comes with you on the day for women to use when they need it.
And it looks like a lot, but we do keep it tidy and sort of tucked away, don't we? It's not all spread out.
But you want all of it there because that's what provides the safety net for everyone.
And everybody's journey is different. Everybody's journey is unique, and so we provide an individualised service.
I find that with other things in my bag too. Sometimes I've got these bags and I never use anything, and then I'll go to one and women will use all of it. So you just don't know what they're going to need on the day.
And we have the postnatal kit as well, so we can do the baby checks. So check their eyes, the hips, and we have all of that we don't bring in.
The scales.
The scales.
So you can weigh and measure the babies, everything. You do everything that could be done in any other model of care.
We don't do the hearing screening. The statewide hearing screening programme is a thing that is very separate. We can't be trained in that. It has to be done separately. So that's the only thing really that needs to be outsourced. Other than that, every single other aspect is here.
You have it all here
at the Nesting Hub.
Fabulous. Okay, let's pack it all up.